Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about Bell's palsy, which is an important topic in general surgery as well as general medicine in all point of view. It is otherwise known as Bell's palsy, is otherwise known as seventh nerve paralysis or facial paralysis. It is the most common neurological disorder which shows aberrant isolated unilateral peripheral facial nerve paralysis. Here, this facial nerve paralysis is because seventh nerve, the cranial nerve number 7 is facial nerve. So it is otherwise known as seventh nerve paralysis or facial paralysis. The name Bell's is because of Bell's palsy because of it is described by a scientist which is Sir Charles Bell. So it is known as Bell's palsy. It is a most common neurological disorder which shows aberrant isolated unilateral peripheral facial nerve. That is only unilateral peripheral facial nerve paralysis, and it shows a aberrant as well as isolated unilateral peripheral facial nerve paralysis. The most common cause of this facial nerve paralysis is etiology is usually considered as to be idiopathic. The causes are unknown usually. Even in the infection, it is reported like herpes simplex virus. In the infection like herpes simplex virus, this Bell's palsy is reported. Compression of the facial nerve. Due to the compression of the facial nerve, the inflammation of the facial nerve occurs, results in edema and compression of the temporal area. Due to exposure of cold, injury during surgical procedure. When there is injury during any surgical procedure. These are the etiology of this Bell's palsy. When it is compression during the facial nerve, compression of the facial nerve means when there is any inflammation near the facial nerve which results in edema. So there is compression in the temporal area. So the facial nerve is compressed. So that this nerve supplying the many areas gets paralyzed. So it is known as facial nerve paralysis. Now clinical feature. The age is not particular, mostly middle aged. Sex is females, mostly in females. Drooping of corner of mouth. Also saliva droops. There is drooping in the corner of the mouth. Also saliva gets drooped. The watering of the eyes are seen. Inability to close or wrinkle the eye. No wrinkles on the forehead. Corner of the mouth does not rises. There is no wrinkles on the forehead when we raise the eyebrow, and we can't even raise the eyebrow, and there is more watering of the eye. Inability to close or wrinkle the eye. The eyebrow does not rises. Mask-like or expressionless face. Difficulty in speech and eating. Altered taste sensation is seen. The main syndrome which is associated with this Bell's palsy is Melkersson-Rosenthal syndrome. This Melkersson-Rosenthal syndrome is associated with facial nerve paralysis. As well as it is associated with fissured tongue. It has fissured tongue as well as cheilitis granulomatosis. The treatment of this Bell's palsy is vasodilator, drug like histamine. And the precaution should be taken to prevent the eye, and surgical decompression should be done. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt in it, please do comment it. If you want more videos, please do comment it. Thank you. Please do subscribe.